So are we ready to go? All right. Well, welcome everyone. We want to thank you for joining us today for our webinar from the Department of Labor. And today we have a very special guest presenting to us, and that is Fran Gray. Fran is the lead benefits advisor with the U.S. Department of Labor, Employee Benefit Security Administration, so the EBSA, and from the Kansas City Regional Office. The Employees Benefit Security Administration is responsible for overseeing the Employee Retirement Income Security Act of 1974, which regulates employee benefit plans that are sponsored by employees in the private sector. Ms. Gray has worked for the Department of Labor for 36 years with more than 15 years of experience in human resources. Her previous work experience in human resources, including having responsibility for the administration of employee benefits and retirement coordination. As a lead benefits advisor with EBSA for the past 21 years, Fran is responsible for providing compliance assistance and education related to ERISA matters for plan sponsors and plan officials, participants, beneficiaries, third-party administrators, and other ERISA professionals. She offers guidance not only on the types of benefit plans which are available for employers to sponsor, but also offers guidance regarding administrative practices to ensure plans are in compliance with ERISA. So we're very delighted to have such an experienced person with us here this afternoon to talk about EBSA COVID-19 response. We are recording this session and it will be available later. And I also put the slide deck for the presentation in the chat box. As we go along, if you would like to, or if you have any questions, you can put those in the chat and or the Q&A box, and we will get to those as we go through the presentation. So Fran, it's up to you now.
All right. Thank you, Stacy, and thank you for the opportunity to reach this audience to maybe provide a little more information about the various regulations and some of those being temporary changes involving our agency's response to not only COVID-19 and some of those changes that are impacted by that, but also we're going to talk about just another regulation that has come out contemporaneously with this that around the same time that I think most plan sponsors, employers with plans that have some very intense disclosure requirements will find quite helpful here in the near future. So we'll talk about both of those and we'll kind of break it into two sessions. The first one being about primarily the COVID, the CARES Act, the Family First Response Act, that information and how it impacts employer-sponsored benefits. And then we'll talk about the electronic disclosure rules. So at this point, we can move on to the next slide. I will tell you, I am not tech savvy with Zoom. So luckily for me, the Small Business Development Center rep here is going to hopefully move those slides for me so we have less issues. So of course, as Stacy indicated, I am with the U.S. Department of Labor Employee Benefit Security Administration, and I work out of the Kansas City Regional Office, although most of us haven't seen our offices for quite some time, as I'm sure some of you may not have either. As you may be able to see with my background, I am currently working from home. And as I said, I am a benefits advisor, which for our particular regional office, that means I work a toll-free 800 number in which I provide information and offer assistance if needed about the particular regulations under ERISA, including those that have been impacted based on our COVID-19 response. So we're going to go through those pretty quick. And so let's move to the next slide. So, as most of us know, on March the 13th, there was a national emergency declared nationwide based on the COVID-19 outbreak. As such, that established period was deemed to be March 1st of 2020. And we have developed some temporary regulations and some additional disaster relief that is specific to how that impacted employer-sponsored benefits for both participants in the plan as well as the employers and or unions that are sponsoring those. Next slide. So let's talk about the families first. These were enacted very quickly after the national pandemic order was issued. Congress took action to pass the Families First Coronavirus Response Act that was effective and passed on March the 18th of 2020. It basically requires that group health plans and health insurance issue cover diagnostic testing for the COVID-19 virus without cost share requirements. And there are some interesting additional information that we'll talk about as it relates to that. What it primarily means that if for reasons based on your health, you need to determine whether you or a family member is um, currently affected by the coronavirus, that test may have in the past not been covered at all, may have required particular deductibles or copays. In this instance, without cost sharing means without cost sharing, no cost to the individual getting the test. And we'll talk about that a little more in depth. Congress very quickly followed that with the Coronavirus Aid, Relief, and Economic Securities Act, which is more commonly known as CARES. That was enacted on March 27th, and it covered some additional information related to diagnostic testing for COVID-19, and we'll talk about that. And then there was some pricing that was addressed as part of that diagnostic testing, and that primarily is about out of network providers or out of your network if you don't have benefits related to that. And so we're going to talk about that more in depth as well. Okay, let's move to the next slide. So we have in particular, hopefully made it easy to find the information on our homepage. As some of you may know, EBSA, the agency I work for, is part of a larger Department of Labor organization. Each one of those agencies operate somewhat independently because we do different things. EBSA has oversight to ERISA, whereas OSHA, everybody knows, has oversight to workplace safety measures. We also, Department of Labor also consists of wage and hour, which most of you are familiar with as it relates to FMLA and or minimum wage, child labor law, those sort of things. So we each have our separate web page that bridges off of the DOL main page. So we have dedicated on our main page a response to the coronavirus, which will then link you to a variety of regulations and information that's available. And we'll kind of go through some of those. We won't go, we may go. Let's just say we may go. It's not part of this particular presentation, but there is a set of FAQs or frequently asked questions that were developed particularly for participants and beneficiaries, where in general, the rest of the information is employer or plan related guidance or plan official guidance in administering those benefits on behalf of their employees. But we'll talk about a little bit of all of these in some detail, not a lot of detail, but some detail. So, but this is where you could link to all of that information off our website if you go to that particular link. Okay, next slide, please. So what we're going to talk about here, and this is what I want to talk about a little more in depth, is the frequently asked questions, part 42, followed closely by part 43. Part 42, frequently asked questions. These are joint publications, and I'll talk about the tri-agency process a lot in this. These are all issued by EBSA, HHS, and the IRS Treasury Department simultaneous, which means all three agencies develop these frequently asked questions along with the answers, as well as the actual administration and the development of regulations in the health arena, which is what the majority of the COVID-19 regulations are intended to do. So. FAQ 43 came out after various questions were raised from FAQs 42. And if anybody's keeping count, that is the maximum we have right now. The frequently asked questions began to be numbered when the Affordable Care Act came out. So if you have some familiarity with the department's regulations, you know that the original health regulations started with the Health Insurance Portability and Accountability Act. That's where that tri-department um, was originally set up. It was originally set up as a task force to implement HIPAA. That process worked very well and very effectively. And so the agencies have maintained that particular process over any new health regulations that have been coming up. So just as an aside, after HIPAA, we had Michelle's Law, we had GINA, Genetic Information Non-Disclosure Act, we had mental health parity, followed by the mental health parity, and I'll get this wrong, Equity Addiction Act, and I may have flipped some of those names in there. I refer to it as MAPIA. That's somewhere close to to what it is. But the agencies still continue to work together to develop those regulations on both sides of the fence. That makes things a little easier. So just to kind of give you a heads up, there's various documents and information that comes out separately if it's specific, and we'll talk about that as it relates to the CARES Act in particular, because there's a lot more to the CARES Act that's not just about COVID and health. That's related to the department. There are some separate tax issues that are primarily with the IRS. But again, I don't have a lot of information about that, but I can at least point you in the right direction. So let's move to the next slide. So I want to make sure that everybody understands that part 42 and part 43 in the frequently asked questions is written in a question and answer format, no different than most individuals are used to looking at from the IRS perspective. IRS writes a lot of their regulations in that Q&A format. Department of Labor does not, but instead we supplement our regulations in the CFRs with these frequently asked questions. So these FAQs are an extension of the regulations, meaning for the most part, they are intended to offer guidance in the department's interpretation of the regulations that were issued, if that's helpful at all. So they went in, currently are in effect. The emergency is declared by HHS, meaning that every 90 days, HHS takes, the Secretary of Health and Human Services takes action to extend these additional guidance that's in effect as long as that national pandemic order. So every 90 days, they make a determination of whether that national pandemic order guidance is going to be extended. It is currently effective, at best guess here without sitting down with a calendar, through January 22nd. The last order, I believe, was approximately October 23rd or 24th, in that area. And so from a technicality, that guidance would be still applicable, and the secretary would have to take action again approximately on the 22nd or 23rd of this month to extend that. We don't have a crystal ball. I would expect that that's going to remain in effect for the near future. But again, today was a change in administration, so we'll see whether that is on their plate as an immediate action or not. But we expect that to continue. Next slide. So let's talk about what actually our part 42, and probably the most important part of that, is the regulation requires a group health plan or individual health coverage to cover the antibody testing for COVID-19 and any diagnostic testing and related service that are furnished in traditional settings. So if in fact there was an office visit charge that was included as part of the COVID diagnostic testing, the plan would be expected to pay that at 100%. No cost share, no deductible, no copays, because it's provided in conjunction with the testing. But for the testing, I think is probably the logic there. This, I will tell you, has probably been the most active area of questions for our office, because when the original regulations came out, I think there was a question is, do we just cover the test only? And then, so that's where the additional guidance, and Congress came back with the additional guidance, said, no, we mean related services to that testing. So I assume, for example, if someone would go to the emergency room and get it tested, and the doctor at the same time would deem it necessary to get a chest x-ray, that also would be covered at 100% if we're looking at diagnostic testing related to determining if the individual has coronavirus and coronavirus related illness. So that has probably been one of the areas where it's been the most challenging. Q&A, specifically Q&A 6 talks about additional charges related to the testing, and then Q&A 7 in part 42 particularly addresses the out-of-network cost, and I want to read that because I want to make sure I get it right for you guys. So, as part of the requirements, out-of-network pricing for COVID testing is supposed to be published by the provider. So under those circumstances, the plan, even an out-of-network plan that would, or a plan that would normally not cover any out-of-network services, must cover and reimburse the provider the cash price as they have listed publicly on their disclosure information website, whatever it is, even though that normally would not have been covered as an out-of-network benefit, because they have a plan that limits benefits to only pay in-network providers. So otherwise, if they're not going to pay or reimburse the provider the cash price is publicly listed, the plan may negotiate a rate that's less than the cash price that the provider has posted. But again, that has to be a two-way street. The provider has to be willing to negotiate as well, okay? So there is a separate requirement that that provider is supposed to make public the cash price for the diagnostic testing. DOL does not mandate that. We don't have any jurisdiction of the provider. HHS, Health and Human Services, does though. And under they have the authority to pose a penalty for a provider that does not comply with that requirement. I don't know if providers are not, it's not an area that comes to the Department of Labor. So I don't know if HHS is seeing any complaints or any information for that. It's just good information to know and have available, that the plan could look to see what that cash price was, and that should be posted. And that way, if they have any questions about what the reimbursement level is, that should be an avenue for which they could make inquiry readily, easily. Next slide, please. So this is where I talked about the increased coverage for the diagnostic change. The important part of this is, if you are familiar at all with basic ERISA requirements, most plans in today's market are cafeteria plan under the group market, meaning that they are a plan that charges premiums on a pre-tax basis. And under that, there are not only some requirements under ERISA, but there's also some additional requirements that IRS requires in order for that plan to maintain that tax qualified status. And one of those things is you can't do certain things in the middle of the year, okay? But with the advent of these regulatory changes, so there obviously plans were required to immediately start covering the COVID-19 diagnostic testing. That's a mid-year change that under most circumstances with the IRS cafeteria plan would not have been allowed. There is no violation or enforcement of any of those issues that otherwise would have required the plan not to be able to implement those changes, and or for the department to take any action for the required disclosures. So for example, if you're going to amend your plan to provide a change in benefits, there is a requirement that there's a 60-day advance notice requirement to certain plan changes. One of those being anything that would normally be required to be listed on the SBC, the Summary of Benefits of Coverage. So under the circumstances, department is obviously not enforcing, nor was there going to be any issues involving the failure of a plan to provide a 60-day notice in order to comply with new regulations that allow for these changes. So it's just a clarification that is enforcement relief, meaning your plan's not in trouble for complying with new regulations that require you to implement immediately. It also allows for increased coverage for telehealth services. There were lots of plans that did not allow for or provide for telehealth services, and of course that was a big encouragement, particularly in the beginning of the pandemic, for non-essential but necessary medical. And again, in that kind of interesting how we make that determination, necessary medical visits and or checkups, but not emergency. And so that's where this telehealth services came in, because a lot of providers moved to provide telehealth services to still handle the basic medical requirements of their patients, but not in person. I'm not sure what was going on up in your area, but here in the initial phases of the pandemic, dental offices were not allowed to provide services. They physically had to close. Most hospitals did not canceled and were not allowed to provide any services other than emergency services, life saving techniques. So the routine colonoscopy or that, they were all canceled. So as we move to telehealth services, we just want to make sure that the telehealth services, that if the plan allows for that and amends their plan to allow for that mid-year, there's some additional enforcement relief that's going to be granted to that. And that is, again, let's go to the next slide. We have certain plans that are not subject to the full set of HIPAA and Affordable Care Act regulations. So let's talk about these accepted benefits for a moment. So under most EAP programs, which are, my EAP program, my employer sponsors one, in which I may need to see or seek assistance from a mental health specialist to determine whether I need to continue on with a recommended treatment. So under my EAP program, I could have up to 4 or 5 visits with a health professional that is free. And it basically, at the end of that assessment, ends up with a referral process. Either, hey, we think you were able to talk this out and what you have a plan of action, or 2, we recommend that you seek additional medical services. So under that, if the EAP plan is not a regular group health plan, but it may very well offer COVID-19 testing just because they are a medical provider or have a network of providers that may be willing and were called to the cause to provide for COVID-19 testing. Okay, so those plans are accepted benefits, the same as an on-site medical clinic would be, and it's okay for them to do COVID-19 testing if they so desire, and it's not going to cause them to lose their accepted benefit status. And that's very important, because loss of accepted benefit status would then evoke the full ERISA requirements under HIPAA and the Affordable Care Act to implement a lot of different type benefits that these plans are not in a position to provide and are typically exempt from. So that's an important relief if they add the COVID-19. So next slide, please. At the same time, um, the additional frequently asked questions in Part 43 make it very clear that self-insured group plans are required to comply with coverage requirements involving COVID-19 diagnostic testing. Although testing for employment purposes is not a requirement of the regulation, some employers are requiring that individuals return to testing to be cleared to come to work. That would not be the plan would have no obligation to cover that. And if there is a facility fee that's related to the COVID-19 testing, they have to cover that. So as example, if you go to the Walgreens rapid testing site and the Walgreens has a $20 facility charge and a $79, and I'm making these up because I have no idea what the real charges are, to perform the COVID-19 testing, the plan would be on the hook for $99 in that particular instance. Again, we're making an assumption that that's a publicly declared cost if they would be an out-of-network provider for the testing. And I would imagine a Walgreens pharmacy may vary, or a walk-in clinic may very well be out-of-network for a lot of group health plans. I wanted to touch base too, and I'm not sure if I missed it or if it's on the next slide. So let's go to the next slide and verify. One of the things that I want to make sure of is about grandfathered health plans, and it does make mention of this. So there are, as part of the Affordable Care Act, there are particular plans out there that were in effect as of March of, oh my gosh, let's go back to that date, 2009. I believe 2010. I should know better. Involving that if they didn't make certain changes, they would be referred to as grandfathered health plans. And grandfathered health plans did not have to provide the full implementation of various measures under the Affordable Care Act. The most significant of those for most people is probably the no-cost preventive services. So if you are a grandfathered health plan, you would have no requirement to cover preventive services at 100% no cost share. Although you may very well do that, you had no requirement to do so. And what the guidance clarifies is that this additional COVID-19 testing and is not going to change or cause a loss to a grandfathered health plan if after the pandemic order is lifted and the plan revokes coverage of the COVID-19 testing, it's not going to cause a loss or a change to their status as a grandfathered health plan. Same goes true for some wellness and some mental health coverage that we're going to go through on the next slide. So next slide, please. So what that does, and again, I'm going to apologize because the slideshow are not necessarily in the order I would have gone through the guidance at. So this one talks more about telehealth services. I think that pretty much goes as we said, but there are some particular provisions related to the exception doesn't relate to these 4 sections of that. And that's important regarding some particular other areas of ERISA. So for example, under ERISA, a plan has some requirements under mental health benefits to have this parity. And by expanding coverage to cover certain services during the pandemic, this ratio would, if you were going through that testing to determine whether the plan was in parity, that may have caused some parity issues. So what we've said is, nope, that you don't have to count these additional benefits under COVID-19 towards that parity concern. And that could be very very challenging for a plan that, all of a sudden it causes them to have, or in order to remain in parity, would have to cause an increase in a benefit under mental health that necessarily they wouldn't have had to do if it hadn't been for the COVID mandates. So that is this frequently asked questions part 43 gets quite in depth to some of these areas. And if you've not had an opportunity to review those, I think it would, 42 and 43, both the frequently asked questions go into quite a bit of in-depth information that I think you would find helpful that we're not going to get through today. But it's a good resource to have in case you have questions. I have them printed out here on, or for the most part printed out. If there's a question that comes up that I might be able to answer, I will do so. So next slide. So there was an interim final rule published by HHS Treasury that were implementing certain provisions of the CARE Acts regarding to preventive services. What that means under most circumstances is when there is a new vaccine, and if those of us that are familiar with the preventive regulations, for the most part, that means that if it's under the A or B preventive service from the USTPF, then the plan, a change involving that would not be required to be implemented by the plan until the beginning of their next plan year. And that's for the plans to be able to prepare for a new no-cost preventive service that previously wasn't on that list. In this particular instance, the COVID-19 immunization. So we're going to vaccinations. I think most of our healthcare professionals are being vaccinated as we speak. I'm not sure where Iowa is in their schedule. Missouri has moved to they say they've moved to phase 1B, but you can't get a vaccine yet. So, but those would be also covered at 100% immediately right now. This would not be a change that is implemented come January 1 of 2022. It's implemented right now. So the plan would also have to cover that with no cost share because it's a preventive service and all preventive services are covered at no cost. So again, there's a huge FAQ as it relates to the transparency of those diagnostic testing. That went into effect November 2nd. So, and of course, vaccines didn't start till after that. So this is applicable to anyone who's received a vaccine. It wasn't applicable prior to that because the vaccine wasn't available. Next slide, please. So for participants, and this is where I want to stop, and we don't have this in the slideshow, but I will tell you the majority of my time spent answering questions and providing guidance to employers is going to be in the COBRA arena and what I call special enrollment rights and claims processing. So even though we don't have that in the slideshow, I want to make sure that we cover that at least very briefly. So as part of preparing your workforce for what's going on and what they should know, the department has a set of frequently asked questions specific to them. There are 12 questions that go through the various changes and what to expect involving health benefits because of the Family First or CARES Act, as well as the department's guidance and relief guidance that's issued. And then there are 11 questions about retirement benefits. We don't have time to go through those today, but that information is primarily, particularly on the retirement benefit side, is about distributions and loans and, temporary waiver of the 10% tax penalty associated with taking a distribution from a 401k plan because of coronavirus. So there's a lot of information that's available, not only from Department of Labor on our frequently asked questions. And again, this link is on the same page as the employer FAQs. We also direct participants to the IRS website as well, where they can get some really in-depth information about the tax issues. I think the most common misconception about the taxes, again, no expert, don't take me at my word here, guys, but the most common misconception is people don't have to pay the tax at all. That is not true. The requirement was for them to basically delay the tax. So That is why we're not going to talk about that information. It's a tax issue. It's primarily with the IRS, but I want to make sure that you guys know where to find that information. So next slide, please. So we're going to talk about ERISA Section 518 relief. And the reason this is important, this is the authority given to the Department, the Secretary, technically, of the Department of Labor to provide relief involving the federal regulations applicable to whether that be a retirement plan, whether that be disclosure requirements under ERISA. So ERISA Section 518 relief allows the Secretary to establish a 1-year period of time in which they can declare um, the equivalent of a disaster. So in response to the National Emergency Pandemic Order, the Secretary of Labor issued Section 518 relief. There are 2 different ways that was done. One is basically to plan officials, where it talks about a lot of disclosure. What if you understand the common theme of ERISA, the ERISA requires plan sponsors, plan officials to provide their participants and beneficiaries with information in a written format, most likely at their home address, so that they understand how their benefits work, how they enroll for those benefits, what their requirements may be to comply with the plan's requirements. And as such, the department grants substantial requirements for plan officials to issue those notices to participants and beneficiaries in the plan so that they understand what they need to do and they understand what benefits that they have. Makes for a smoother process. So the 518 relief, there are, again, to furnish benefit statements, annual funding notice. So the relief is still in effect. It's in at the present time, at least until February the 28th. Again, the Secretary of Labor would have the authority to, if the national pandemic order is still in effect on February 28th, to once again evoke Section 518 and continue relief or modify the relief in whatever manner that the Secretary feels is necessary to help both plan sponsors and plan officials with their responsibilities under ERISA. So basically the condition is that the employer, the plan sponsor, has to make a good faith effort to finish the documents as soon as administratively practicable. Now, for most requirements that this was very important early in the pandemic, where we had pretty much a nationwide shutdown. During that period of time, certain plans were required. There were some things that were required involving underfunded multi-employer pension plans. There were some particular filing requirements, M1 filing requirements to the department that were required as of March 1, and there is some specific relief granted timeframes to that, as well as this general relief, and we're going to talk about that a little more in details. So electronic communications is going to be, if those who already had electronic communications, and we're going to talk about those a little more in relief when we go into the next section. So next slide, please. So what the Disaster Relief Notice 2020-01 did specific was extend some time of filing deadlines. It also extended some deadlines for the notice requirements about loan procedures. There were some changes to the blackout notices. Blackout notices typically are required 30 days in advance of a blackout period. So there was some general relief granted in relation to that. The notice is posted on our website. It's easy to get to. The interesting part of the relief notice also talks about some enforcement relief involving particular things that may not be specifically listed, but because of the coronavirus may have impacted the normal business operations of the employer, which resulted in some, so for example, maybe some late 401k contributions early in the process. Because if you shut down your entire business and you don't run payroll, or you ran payroll to make sure everybody got paid, you may not have done anything else after that. So there is some information about how that is affected as well. Next slide, please. So there is a final rule out that involves both as we said, the two agencies about the relief period. And again, it just extends some special. This is where I thought we would have some more questions that came up. COBRA administration right now, along with administration involving group health plans, special enrollment rights, are all subject to the relief. Department of IRS guidance said that plans may choose to implement changes. DOL guidance said the plan had to make these changes. So what that meant was, for the most part, is that any special enrollment period or COBRA election period or COBRA payment period is told during the pandemic. So I'll walk you through a very short example. So let's indicate that we had an individual that had a COBRA qualifying event on February the 14th of 2020. The employer was on the spot and got that COBRA notice issued to that individual on March 5th of 2020. On May 4th, I believe the department issued guidance retroactive to March 1 that basically said that beginning March 1 until 60 days after the announced end of the national emergency pandemic order, that any timeframes associated with those type enrollments were being told. So in my example, the individual received a COBRA notice dated March 5th. March 5th would normally start that individual's 60-day election period to make a determination of whether they did or did not want to take and keep their COBRA coverage. Under this relief granted by the department, that individual still has a 60-day election period that has not yet begun. So even though they had a qualifying event on February the 14th, their COBRA notice was issued March 5th, would normally start their 60-day election period. But because of the relief granted retroactive to March 1, that election period is still ongoing. This is the same for special enrollment rights, as most of us are aware. If you would lose your coverage, other than failure to pay premium or something of that nature, you have a right to open up another group health plan, such as your spouse's employer, where you've previously waived the coverage. And you typically must do that within 30 days of the loss of coverage. Again, that 30-day special enrollment right is being told right now as long as this order is in effect. So same example, spouse lost coverage February 14th, got a COBRA notice March 5th, lost coverage February 28th. Under normal circumstances, the individual would have until approximately March 2nd to have notified their spouse's employer that they are requesting a written right to enroll for that group health plan coverage and as of right now, they could still request that because that fell into the March 1st or later period. They have only, because the loss occurred February 28th, their 30-day special enrollment period has not yet begun. By the same token, the individual who lost coverage February 14th in my example instead of February 28th had used 14 days of that 30-day notification period to request coverage under the new employer group health plan with a spouse, and therefore would have 16 days that are being told. So in my example, if the national pandemic order would be lifted, let's say in May, under that circumstance, they'd have they'd have that additional 16 days to still evoke that special enrollment right. Now, employer's obligation under special enrollment is to make coverage first of the month following the date in which a timely request is made. So they would be without coverage during the period of time in my example from, March 1st coming forward, but they would still be allowed to exercise a special enrollment right. So that can be challenging. Those same extensions apply to appeal periods for claims. So if the health plan denied a claim, technically, let's say on August the 1st of 2020, the individual would normally have 180 days written appeal period. The 180-day appeal period is being told right now. So some of these challenges are going to come forward after the pandemic order is completed and trying to sort out some of these timeframes associated with the relief period. We are not here to bust anybody. We are here to help plans figure out how to comply and what needs to be done. I've had a couple of special enrollment rights just simply because the employer was unaware of the department's guidance. Very easy, very simple to have fixed. The employer, when we directed them to the guidance, said, "You're right. We'll get these people enrolled for coverage," and then you move on. So we're here to try to help. We know that this can be challenging administratively, particularly for employers who also have a set of workers that may be, you may have a production facility that's partially operating, but your entire corporate staff or your benefit staff are all trying to work from home as well. So again, we're here to help. We are available, as you can tell. I'm working from home myself. But we're here to help answer questions and direct you to information that you may find helpful in trying to figure this all out while we're all trying to deal with just the health ramifications themselves of your staff and your workforce that may not only be ill or dealing with family members that are ill, but trying to navigate this process as well. So we're here to help. I want to let everybody know, if nothing else, that you take away from that we operate that toll-free number Monday through Friday from 8 a.m. to 4:15. We provide as much significant employer and plan official guidance as we do answering participants' calls that are asking questions. So we want you to know we're a ready resource and can be helpful. This isn't a gotcha game. We are very much trying to just help people, including employers, figure out how to comply with these regulations. So with that, let's move to the next slide, which I think should be our electronic disclosure. So this is the point that if you have any specific questions about COVID, or those timeframes we just talked about, or the relief, I'd like to kind of get those answered right now while we're still on that subject matter before we move to this totally unrelated electronic disclosure safe harbor for retirement plans.
So are there any questions? You can put those in the chat or the Q&A. And Fran, we have about 5 to 7 more minutes left for our allotment of our time here today. So
great.
I am not seeing any questions.
All right. Well, then let's move forward, and then if there is another question or two that develop, you have a few minutes there to put that forth. Let's go to the next slide. So we published this final rule back on May 27th. Again, is non-related to the pandemic, but has become what we believe very helpful during the pandemic. So as I had mentioned previously, the department requires a lot of written disclosures, primarily mailed to plan participants' home addresses. And so we're going to talk about the 2 safe harbor disclosure, electronic disclosure requirements, and we'll jump into those pretty quick. Let's go to the next slide. So plans that have relied upon this rule to eliminate the paper mill and the extensive costs associated with producing paper. When EBSA finalized this rule, they estimated that the cost savings was $3.2 billion. to retirement plans. So that's a lot of saved money, both whether that be out of participants' accounts who pay part of the administrative costs, or the employers who are paying those administrative costs to operate those programs. Again, in the short term, we think this has become very helpful to responding to the COVID-19 emergency. Next slide, please. So this is an additional way. It's not a mandatory way. It's not a required way. It is an additional way that that plan officials are going to have to relay effective communications to their employees about their retirement and their savings and the information that is necessary for them to make decisions about their future retirement. Next slide, please. So as I said, it's a voluntary safe harbor, and the plan can use this as their default method of communication. Um, so under that, they can use this electronic media, and that is either through email or through a dedicated website where documents are posted. And we're going to talk about that. So next slide. So the web posting has to have a disclosure, as does the email delivery to the participant, that this is where the information is available. So under the email, which I think is what most employers have done in the past that were taking advantage of the prior safe harbor, they've been because their workforce is primarily accessible and they all have email. So if you were able to do that, great. Well, this allows this to be the default or the web posting. Let's go to the next slide. The web posting is the one that is particular. So these are required disclosures that are for covered individuals. So you have to be careful with that, because there are other individuals that may need some disclosures that you cannot default this to. So they have to be entitled to ERISA to receive covered documents, and they have to have a valid electronic email address and or a smartphone phone number that does not supersede a prior safe harbor that was in place since 2002. That one, let's go to the next slide, primarily requires that these individuals know that this information is going to be disclosed this way. So let's go to the next slide. There's a lot of slides that basically are 2 sentences, guys. So I apologize. I didn't develop these. I just have to present them. So, so what it still protects is the participant's right to basically opt out of any electronic delivery anytime, free of charge. The employer can use it as a default, but they cannot mandate it, which means that the individual, all they have to say is, I don't want electronic delivery. I want to get paper copies, and the employer is going to have to allow for that. All right, next slide. So what that allows is that the covered individual has to get an initial notification, the same old way they used to get them on paper, that their method of disclosure is going to change. Okay, it has to tell them what their new delivery method is going to be. It's going to tell them the address that they're going to use, and that the fact that they have a right to opt out if they so desire. It also says that the relief has also said that if the plan utilized the new safe harbor since the March 1st days, the department is not going to enforce or punish the employer for doing so. Okay, I think we're probably at the end of this. Let's double check. Oh, I'm wrong. So the web is probably the most challenging. So if the employer is going to use the website posting as their default delivery, there are 2 things that they have to do. One, they have to make sure that every document is available and on that website for at least 1 year, even if it gets replaced or amended. Okay. However, we know that can be really challenging. There's a lot of disclosure regarding retirement plans. So the plan is also allowed if there is a standard document that doesn't require any action by the participant. So like summary plan descriptions that describe the basic benefit itself, or the annual funding notice, which is just a requirement for them to learn about the current funding status of their retirement plan. Those notices can be that one notice, once a year that says, hey, all these are posted on the website is okay, instead of one every time that gets posted for that year. But again, they have to be notified in advance of that information under most circumstances. So after this period is over, we're going to go back to these are all still going to be required to be done in advance. So I will also tell you that it has to be very short and only contain the necessary information. So that that notice, one-time notice at the beginning of the year that said here's the the notices for this year that are posted to the website, can't include any other information. You can send, and by the way, everybody has to make sure you turn in your time card by Friday because it's a holiday. So you can't have any additional information. It has to be very specific to just this website notification. And now I think we are probably done. Let's go to the last slide, which should contain some information about the website retention. Let's go ahead and forward. Oh, I did forget this. Yeah, under the electronic disclosure, if you get a bounce back on an email or a phone or something that says it's not valid, or that address isn't valid, or it's not working, the plan administrator has two choices. They can attempt to immediately cure the problem, and we say promptly cure the problem means you can't wait 3 months to say, oh, let's figure out what happened to XYZ's email address. Or you can just at the time that occurs, treat that person as being opted out and return the notice to paper delivery. Next slide.
Looks like we're at the end.
Oh,
no,
sorry.
There it goes.
Okay, so that's just, it should be my contact information. Is that there? I'm not seeing, there's just a couple of things. Just so you know that we have a non-enforcement policy. This is my contact information in the office. There are 10 of us, well, actually 9 of us now, available to answer questions about any of these subject matters, as well as the website. We appreciate the opportunity to have have presented this today, and hope it was helpful to the community attending.
All right, well, thank you so much, Fran. Definitely a lot of information, a lot of things for businesses to know. And I think the main takeaway, like you said, is if you have questions, to reach out, and that the Department of Labor is there to assist and to get the correct answers out to these businesses. So thank you very much. And we shared the slides here so that you will have Fran's contact information, or her office's contact information. And we thank you very much, Fran.
All right. You guys take care, stay safe, and let me know if you have any questions.